Hi, today I want to share the case with you which I did in my office, and it was 7 restorations from 5 to 12. 5 of them are EMAS crowns, and 6 and 11 was laminates. According to this picture, initial picture, patient came to me was not satisfied with aesthetics. She was concerned about discoloration in her teeth, again decant, and also she wants to change the color of the teeth, the shades. So we can see that she was having in the past placing the bonding composite material to mask the yellowish of your teeth, and also try to improve probably the shape. So you can see the bonding failed, and we came to discussions of what she wants at the end. She definitely doesn't want to have any ortho. The patient is 70 plus years old, and she wants to have something quick and easy, the procedure to change the shape and the color of your teeth. We also can see that the cant of your maxilla. We know that we're gonna have problems if the cant of the maxilla is more than 3 millimeters. But in this case, we can see that number 6 a little bit longer than number 11. We can shorten the teeth on the right side of the patient, a little bit elongate the teeth on the left. We also can see that the cant of the mandible is not the same as the maxilla, so that's what the plus for us. We also had to pay attention that where the canines on the lower mandible locate, and we see that they're not located where the upper canines are. So the patient doesn't have a canine guidance. And when we're going to design the case, we also have to keep it in mind it's so to improve the guidance so we don't have any damage on your front teeth. So by looking again at the cant, we also see that if the patient has the cant also in the mandible, then in the maxilla together, then probably she would need the surgical part. We also offer the patients to do upper and lower teeth at the same time, but she wants to be conservative and she wants to do only the upper teeth. So far, that's in to see how design and her experience with aesthetics would be, and then she will decide on the lowers. So let's see that another picture, which is plus for us. Her teeth is aligned a little bit with the lower lip line. So the midline is almost in the middle of the face, which is good. And what we have to do is try to get all the information, give the prescription to our technician so he can do wax up. And what we do in my office is the technician design the wax up, and we apply on top of her teeth. When we do that, patient look at the final result before we do any reversal procedures, give us approval on design. But of course, when we applied this mock-up, we have to also keep in mind that some of the teeth may be longer than it should be on the final restorations, and maybe we have to do some minor adjustments. So when we apply the wax up, we also asking the patient for the approval, and the patients also can see the future color of the teeth, what you would like to have as a bleaching color, natural shade color. So if the patient is a little bit in doubt what probably shade she wants to have at the end, I'm trying to use several different temporary material shades, so finally the patient can choose which one she wants. So in the next picture we can see a little bit wear on her front anterior teeth and the bottom, but again it's we have to ask the patients, is it probably something in the past or something that's active. Probably she can see within 5 years, she can see the changes, the position again, and the wear on her teeth. We can also see the wear she has on the upper front teeth. You also have to keep in mind that the enveloping function probably was a little bit affecting those teeth, and we have to also pay attention on the notch on the incisals right here. So we also have to keep in mind that when we're going to design the crowns, the final prosthetics, our technician has to keep in mind it's to keep almost the same notch on the final ones, so the lower jaw will be rest against the restorations, and will not distalize with the convex of the restorations and cause the problem with the restorations of the TMJ. So the next slide is showing us how we prep the teeth. As I said before, that's the 5, 12, and 7 to 10 crowns, and 6 and 11 laminates. We also add the composites on the 22, 27. You can see there's a little bit upright position, and we improved the canine guidance so the patient doesn't rest her teeth against the lower ones. And also we can see we improved a little bit the line of we fixed the cant as much as we could this patient. Of course we have to a little bit improve the cant on between the front and anterior teeth, but as the whole also has to follow that's the papilla line. It has to be perpendicular to the papilla line so people won't see the cant between two anterior teeth. You can see here that's how she smiles. Again, it's we follow the lower lip line. Patient's happy. We gave her the bleaching color, so maybe it's again depends what she wants. So she called us and said it's the bleaching color is going to be too white, so she wants to go with a little bit darker color, but it was want to have them like custom made. The patient came back to me in 3 weeks wearing those temporaries. I want to make sure that she's happy, the bite is alright, she's comfortable, and when she gave us the plus, I mean approval sign, it's we finally cement the restorations. You can see this picture 1 week follow-up. You can see the tissue and the crowns and laminates have been cemented. The patient is happy with the aesthetic and design, and he came back to us 6 months after to do her lower anterior teeth. Once again, if you have any questions, you can email me at markgregorydds@yahoo.com, or you can visit our website foresthillsdental.com and see more information. Thank you very much.